Today, I'm going to talk about an annular tear. Shall you just be careful for the rest of your life, or should you fix it when there is an annular tear? There are various views on this point. First point is that the torn part attaches itself, so don't twist or bend your back and don't exercise. Then it's okay if you're careful. Second point is that torn disc areas should actively be treated using endoscopic lasers or high-frequency heat. The third is that if you exercise hard, a torn disc becomes stronger. Those are 3 points of view. How is it actually? If the fibrous annulus surrounding the disc is torn, it is like a tire on a car is torn. A piece of the disc or fragment is stuck in this torn tire. When it is torn but there is nothing in between, it is a lumbar sprain and it usually heals well. Or in the early stages, when the disc is torn and the gel inside is only slightly leaks out. Most of the time, it heals on its own when the herniated disc is absorbed. Disc herniation should usually be cured within 6 weeks. If the back hurts 3 or 4 times a year even after 6 weeks, or it hurts several times a year even after 10 years. What are the characteristics of these people? What is the case that the annulus fibrosus is torn, but it does not heal on its own? Like a stone or nail stuck in the tire, bad flesh is stuck inside the torn annulus fibrosus. Why does this bad flesh keep getting stuck? It's because new blood vessels and nerves grow in and continue to receive nutrition. So it's not absorbed on its own. Usually, completely isolated disc fragments are not nourished. They are absorbed by themselves. Look at the picture. Because the annulus fibrosus continues to be nourished, new blood vessels formed and turn red. Can you see the tear look red in the picture? It's torn, a bit in the front and also in the back. The reason why it doesn't absorb and doesn't heal on its own is because there's bad fragment in between. It should heal naturally within 6 months at the latest. If you run or jog, that day is fine. But the back pain gets worse the next day, or 3 days later. Those who do not straighten their backs when they stand up after sitting for a long time, it takes a lot of time to straighten the back after a long drive. If the annular tear persists for more than 6 months, the cause should be treated. Even after 5 years, it still hurts. Now, this is an MRI of a very famous professional golf player. Annulus fibrosus is torn. Because of the torn annulus fibrosis, it was difficult for her to bend over to pick up the ball. She said she could do all 18 hole rounds, but she continued to feel back pain in the middle or even after finishing. Anything that looks white is bad flesh. After removing that bad flesh with an endoscopic laser, she became completely normal person who can play golf well. She works as a golf commentator after back surgery, teaches juniors, enjoying active life. Those who continue to be uncomfortable for more than 6 months should treat the annular tear with a causal treatment. I'm not asking you to do surgery. It means to get the endoscopic laser treatment. Thank you.